Hi everyone, it's Social Natalie with Options Community Services. I'm actually going to go in and we're going to do things a little differently today. For confidentiality reasons, we are actually not going to be showing the people that I'm interviewing today. So you're lucky, you're going to get to look at me the whole time. So this will be interesting. So we're going to go in here and we're going to interview a support worker and a program coordinator for the Fraser Health Crisis Line. So let's get in here. So we're actually here in the call room. You can see behind me. Hi, how are you guys?
Great, thanks.
So I've already told everybody that they can see me, but they're not going to be able to see you while I interview you. So we're good with that? Okay, so first off, I've got a support worker here for Fraser Health Crisis Line. And I think what's important is for everyone to find out maybe your journey and what brought you here working at the Fraser Health Crisis Line.
For sure. So yeah, I started as a volunteer here because I wanted to kind of just give back, but also it was really going to help me in the field that I wanted to get into for work in the future. And from there, I volunteered for just over a year, and then there was a job opening and to work with the crisis line, and I took that position. I've been a support worker for the past. Well, I took the nighttime position first for about 5 months.
Okay.
For call taking. And then after about 5 months of that, I moved on to a support worker role, which I am now. So.
Okay. So how long in total then have you actually been doing this?
As staff, well, starting from volunteering, just under 2 years now.
Okay.
Yeah.
Great. And can I just quickly ask you, what actually made you decide to volunteer in the first place?
Yeah. So like I was saying, trying to kind of get into my field of work for what I want to do in the future. That was a huge part of it. But also kind of like just giving back. And I found it really rewarding coming in volunteering. I really, really enjoyed it when I came in, and it truly felt like I'm accomplishing something each day that I did volunteer. So. Oh,
that's nice. And you still get to do that now?
Absolutely, yeah. Just in a different role, supporting the volunteers now. So.
Fantastic.
Yeah.
Great. Thanks for sharing. And we'll just move over here. Still looking at me, but we're going to ask the program coordinator. How are you?
Great, thanks.
Good. So tell me a little bit about the crisis line, maybe starting with what the hours of the crisis line is. Okay.
So we operate 24 hours a day, every day, so 24/7.
Okay.
And we've been doing it for more than 47 years.
Okay.
And last year we received 48,000, just over 48,000 calls.
Oh, okay. That's quite a few calls.
We are the highest call center in all of British Columbia.
Is that right? Okay. Excellent. How are the services delivered here at the crisis line, or by whom? And maybe tell me a bit about that.
We rely on volunteers. Our services delivered by skilled, compassionate volunteers. Most of them are preparing for careers in medical, mental health, counseling, police professions.
Okay.
So they're seeing the crisis line as a way to give back to the community,
for sure,
but also prepare them for their future.
For sure. That sounds about right. And maybe you can just go over like all the services that are provided by the Fraser Health Crisis Line.
Absolutely. We provide emotional support, crisis intervention, community resource information to people of all ages for all areas and issues of concern.
Okay.
Our newest initiative, which is part of Fraser Health's response to the opioid crisis, is to provide low barrier access, again, 24 hours a day, and give the caller an anonymous place to start. So whether it's somebody seeking help or seeking help for a friend or family member, we drive callers to the Fraser Health website where they'll find lots more of information.
Okay.
We assist callers in creating a harm reduction game plan, and we contact callers with the substance use services access team. So we're trying to connect them with the new substance use service access team.
Oh, okay. Wow. All right. Oh, that's actually more information. You actually covered all my other questions as well. That's good. And how long have you actually been working with the crisis line?
I was a volunteer here for 12 and a half years, and I've been a staff member for 4 now.
Oh, okay. Fantastic. What's your favorite thing about working for the crisis line?
It's still giving back. I mean, the sense of reward after knowing in any given shift that you've helped somebody.
That's great.
And that's what's kept me here, that's what brought me here, and I think most of our stories are very similar that way.
I'm sure they are. People, starting out volunteering, giving back, and wanting to be a bigger part of that.
So if anybody else would like to help give back to the community, they can go to the Options Community Services website, options.ec.ca.
Perfect. And they can
find
out.
Follow the links to volunteering, be it with the crisis line or any of our other services.
Perfect. Well, thanks for taking the time to meet with me on this sort of backwards interview while people get to stare at me. But yeah, we do respect confidentiality for everyone. So I appreciate you guys taking the time to meet with me.
Yeah,
Thanks for meeting with us.
All right, thanks so much. All right, if you guys have any more questions, go ahead and visit options.bc.ca. We'll see you again soon.